So we're going to now talk about the examination of the ear. There are some structures of the external ear that you should be aware of. This is referred to as the helix. This is referred to as the antihelix. This is the lobule of the ear. This is the tragus of the ear. We can see the conchal bowl and then the external auditory meatus that goes in here. If we flip the ear forward, we can see the mastoid tip here, to which the sternocleidomastoid muscle attaches. We can palpate the mastoid tip for any tenderness. If this were a tender and Brittany's ear was pushed outwards and downwards and there was fluctuance behind here, we would suspect mastoiditis. So we'll now talk about the examination of the external auditory canal, the tympanic membrane, and the middle ear space. When we're examining these structures, we use an instrument called an otoscope. An otoscope also has an attachment on the side of it here to which a bulb can be attached. With this bulb, I can pump pressure through the otoscope and actually see the tympanic membrane moving. If the middle ear space contained fluid, the tympanic membrane would not move. So it is a very good diagnostic tool for diagnosing things such as an otitis media with an effusion or an acute otitis media with pus behind the eardrum. Before I insert the otoscope, I need to use my ensure that I do not cross my hands. So I use one hand to grab the pinna of the ear and pull it up and outwards in order to straighten the external auditory canal. The next thing I do is I take my otoscope and I rest my hand on Brittany's cheek here and insert the otoscope into her ear, taking care not to go too deeply, as this will cause her pain if the otoscope actually contacts her bony external auditory canal. Then I can look through the otoscope and examine the necessary structures of her ear. So I've now moved to Brittany's contralateral right ear and I'm going to examine it. As you will see that I need to switch the scope from this hand, my left hand, to my right hand now in order that I don't cross hands. I now use my left hand to pull on Brittany's pinna to straighten the external auditory canal out. This is also an important clinical finding in otitis externa. If Brittany had inflammation of her external auditory canal, this would cause her significant pain. Again, I rest my little finger on Brittany's cheek here and then insert the otoscope. The importance of this type of physical examination or formation of my hands is that if Brittany were a small child and if she moved her head, my otoscope would move with her. If I was not resting my hand on Brittany's cheek and she was a little child, she would move her here and the otoscope would injure her external auditory canal. This is why it's important to rest your hand that's holding the otoscope on your patient's cheek and then insert the otoscope. We're going to use a rigid telescope or endoscope here and insert it into Brittany's ear to highlight the important structures that you should be seeing when you look with an otoscope. So I'm going to pinch, again, grab Brittany's pinna here with my thumb and my index finger and pull and straighten out that external auditory canal. And the part that I'm straightening out here is the membranous or the cartilaginous portion. As I insert it and move past the hairs of Brittany's ear, we can see the bony external auditory canal and a beautiful view of her tympanic membrane. We can see, I'm just trying not to hurt Brittany here. We can see here the annulus of the eardrum, the malleus, the incus, the stapes, and the chordae tympani nerve running across the eardrum. The eardrum is in normal position, it has no perforations, and the middle ear space appears relatively clear. And here is the round window of the middle ear as well. Okay?